In this lecture, we're going to look at the arm. So we're going to start off by looking at the arm in cross-section and returning to the brachial fascia we spoke about. We'll also look at how it forms the intermuscular septa. We'll then look at the anterior compartment, the biceps brachii, brachialis and coracobrachialis muscles, and some neurovascular relations in the anterior compartment. We'll then look at the cubital fossa that lies directly anterior to the elbow joint, its boundaries and the contents, and then we'll finish by looking at the posterior compartment, specifically triceps brachii, and again some neurovascular relations. So if we look at the compartments of the arm to start with, then this is a section through the arm, and we can see that we've got the humerus here, and then lying anteriorly we've got this surface here where we've got the subcutaneous tissue and the superficial fascia, and then we've got this line here that's running around the muscles, and that is the brachial fascia. So we're going to look at that in a bit more detail. When looking at cross sections, it's important to realize, as this diagram here indicates, that we're actually looking at it from below. So here we're looking at it from below. So this is the medial aspect here, this is the lateral aspect, this is the posterior aspect, and this is the anterior aspect. So the transverse section of the arm reveals the brachial fascia forms two muscular compartments. It does this by way of the lateral intermuscular septum and the medial intermuscular septum. So what we can see here is the humerus, and then on the outside we've got the brachial fascia. We can see the brachial fascia dives deep here laterally into the depths of the arm and attaches to the humerus. We can also see similar here where we have the brachial fascia running around the outside, and then we've got this medial intermuscular septum running in here. And that creates two compartments. It contains the anterior compartment and it contains the posterior compartment. The anterior compartment is the flexor compartment. The posterior compartment is the extensor compartment. So they flex the elbow joint and they extend the elbow joint muscles in these compartments. Importantly though, it's important to remember that some of these muscles also act on the glenohumeral joint, as we'll see. So the majority of the muscles in the arm do act on the elbow joint, and principally there are two types of movement. We have flexion and extension. We also have pronation and supination. So the muscles within the arm act on the elbow joint, and they also act on the radio-ulnar joints, which allow pronation and supination to occur. So we'll come back to these as we progress through the course. So if we look at the anterior compartment of the arm, then there are three muscles that I want you to be aware of in the anterior compartment. These are coracobrachialis, brachialis, and biceps brachii. If we start off with coracobrachialis, then this is a relatively short muscle. As its name suggests, coracobrachialis, it's running from the coracoid process of the scapula. Again, this is why those bony landmarks on the scapula were important, to the shaft of the humerus. And here we can see we've got coracobrachialis running from the coracoid process of the scapula to the middle third of the humerus. It's supplied by the musculocutaneous nerve. The musculocutaneous nerve that was coming from the brachial plexus. This muscle doesn't cross the elbow joint. It just crosses the glenohumeral joint. And because it does that, it flexes and also adducts this joint. If we go back and look at biceps brachii, we can see on this picture, we can see biceps brachii has two heads, as its name suggests. We have a short head that is running up towards the coracoid process, and we also have a long head that is running up towards the supraglenoid tubercle of the humerus. The supraglenoid tubercle, that tubercle above the glenoid cavity. The tendon of the long head actually takes quite a long journey. It passes up within the intertubercular groove. The intertubercular groove formed by the greater and lesser tubercles of the humerus. So here we see the long head of biceps passing to the supraglenoid tubercle by passing through the intertubercular groove. The short head here attaches to the coracoid process. Here we can see the biceps, which is running within the anterior compartment of the arm, the muscle belly of biceps, and we can see that its main attachment is onto the radius, the radial tuberosity, which we can see here. It also gives rise to the bicipital aponeurosis, and that blends with the brachial fascia. Another muscle here is brachialis, and this muscle, like biceps brachii, crosses over the elbow joint, but because it's originating from the mid-shaft of the humerus, it doesn't cross the shoulder joint, whereas here, biceps brachii does. Brachialis coming from the middle third of the shaft of the humerus, it passes all the way down onto the ulna, and we can see brachialis muscle here. This muscle is only going to act on the elbow joint. So if we look at biceps brachii, its long head, its short head, we can see it's originating from the supraglenoid tubercle or the coracoid process. It passes to the tuberosity of the radius, and it blends with the fascia of the forearm via the bicipital aponeurosis, as that continuation of brachial fascia passes down into antebrachial fascia. It's innervated via the musculocutaneous nerve, and it has a whole range of functions. It's the chief supinator of the forearm. Because of its attachment onto the radius, contraction of biceps will actually supinate the forearm. So from this pronated or mid-prone position, the first movement of biceps will be to supinate the forearm. Once the forearm is supinated, continued contraction of biceps will then flex the elbow joint, but only once the forearm is in this supinated position will it then flex. Continued contraction of biceps, because it crosses the shoulder joint, can lead to flexion of the shoulder. Brachialis, as I mentioned, comes from the distal half of the humerus, and it attaches to the coronoid process and tuberosity of the ulna. It is also supplied by the musculocutaneous nerve, and it flexes the elbow joint. What you'll notice is that the muscles in the anterior compartment of the arm are all supplied by the same nerve, the muscular cutaneous nerve. That terminal branch coming from the lateral cord of the brachial plexus is giving rise to the musculocutaneous nerve that supplies the muscles in the anterior compartment of the forearm. So if we look at these in a bit more anatomical position, then actually to see these muscles we need to remove deltoid. So on the slide at the moment we've got a muscle here, we've got, an anterior view of the right arm with deltoid in position. We've also removed deltoid on this picture, and by removing deltoid we can then see the position of the long head of biceps here. We can also see the short head of biceps here. The muscle belly of biceps is in place here, and we've removed it on this picture to see brachialis lying underneath. So hopefully you can appreciate that brachialis is sitting directly deep to biceps brachii muscle. It's very difficult to see brachialis muscle with biceps brachii still in place. Just see a small bit of it here and here. We can see we've got the bicipital aponeurosis passing down onto the antebrachial fascia of the forearm. So that we can see, if we look at these notes which we have here, that running over the intertubercular groove, we have what's known as the transverse humeral ligament, and that runs over the two tubercles on the head of the humerus, and this creates a tunnel for the long head to pass through. As I mentioned, distally, the two heads of biceps unite, and this continues down as the bicipital aponeurosis. Deep to biceps brachii is brachialis, and medial to biceps brachii is coracobrachialis, which we can see here. So we can see in these pictures all of the muscular put together into one anterior compartment of the arm. If we look at the neurovascular relations of the anterior compartment, Then we can see in the diagram, we've got our brachial plexus again. We can also see we've got some important blood vessels and their neighboring nerves as they descend distally towards the elbow joint. So we can see the musculocutaneous nerve once again. We can see the median nerve. We can see the ulnar nerve. And these are running down this medial aspect of the arm. We can see them running all the way down the medial aspect. We can see actually here the medial intermuscular septum of the arm. And remember, that's separating the anterior compartment from the posterior compartment. Here we can pick up the auxiliary artery, but we can also see its relationship to the brachial plexus. And then as it runs down, it becomes the brachial artery. And we can see the brachial artery is running in a groove between biceps brachii and brachialis muscle. So here we've got biceps, and deep to biceps, we've got brachialis muscle just here. And in the groove between, we can see the brachial artery. We can also observe, if we go towards the anterior aspect of the elbow, the bicipital tendon, which we can see here. And that is forming a roof over the brachial artery and the median nerve. So the brachial artery and the median nerve are running underneath the bicipital aponeurosis and the biceps tendon. And this is the cubital fossa, and we'll cover that in future slides. So if we look at the boundaries of the cubital fossa, these are made up of both muscular and bony boundaries. We've got a superficial view here, and we've got a slightly deeper view here. This is the anterior aspect of the right arm, elbow, and then we've got the forearm here. We can see the muscle belly of biceps brachii. We can see brachialis. We can see running across the elbow joint, we've got the bicipital aponeurosis. And running down in this direction, we'll find those parts that run in the cubital fossa. If we just look at the boundaries to start off with, the cubital fossa is this shallow triangular depression directly anterior to the elbow joint. The boundaries superiorly is a horizontal line indicated here in green. It's really an imaginary line that's running between the two medial and lateral epicondyles. So it's running here. We've then got the apex of the triangle being formed laterally by brachioradialis muscle, we can see here, and medially by pronator teres muscle, we can see here. So if we continue these boundaries up to the superior boundary, we can find our triangle. And this is our cubital fossa. The floor of the cubital fossa we can see in this deeper dissection. We have brachialis muscle here, and we also have another muscle known as supinator, and these form the floor of the cubital fossa. So now brachioradialis here has been reflected. We can still make out pronator teres running in this direction, but because the bicipital aponeurosis has been reflected, we can see into the space of the cubital fossa. The contents of the cubital fossa, well, there's a nerve, there's an artery, and there's a tendon. So here we can see on the right elbow joint, the cubital fossa. And from lateral to medial, we find we have a tendon, we find we have an artery, we find we have a nerve. In a deeper dissection, we can see the cut tendon, we can see the artery, and we can see the nerve. So from lateral to medial, we have tendon, artery, and nerve. We have, if we look, the bicipital tendon, we then have the brachial artery, we then have the median nerve. We can see that in this deeper dissection, the bicipital tendon has been cut, bicipital tendon, brachial artery, median nerve. Running over the cubital fossa, we have the median cubital vein. Remember, the median cubital vein was formed when the cephalic and the basilic veins were ascending up the upper limb, and at the elbow there was this union between the two, which is the median cubital vein. We can see the cut cephalic here and the basilic here, and running across would have the median cubital vein. We also have various cutaneous nerves following the basilic and the cephalic veins, and these are supplying the forearm. So, the contents, to recap, within the cubital fossa, we have the termination of the brachial artery, we can see here. If we follow the brachial artery deep through the cubital fossa, we find we have it dividing into the radial and the ulnar arteries. We can see we have the median nerve. We can see we have the biceps tendon. If we were to just move brachioradialis to one side as we reflect it, we'll see that we also have the radial nerve positioned here. Not really in the cubital fossa when it's all intact, but by removing the brachioradialis, we can expose the radial nerve. So the contents of the cubital fossa. Bearing in mind that for venipuncture, the median cubital nerve is approached, then caution has to be taken by the medical practitioner that they don't pass the needle too far and start rupturing these structures. Now let's move on to the posterior compartment of the arm. These muscles that lie behind the humerus and the median lateral intermuscular septi. What we have are triceps brachii. This muscle has got 3 heads, a long head, a lateral head, and a medial head, which we've seen some of before. We've mentioned the long head when we covered various spaces. We can see the long head here is passing from the infraglenoid tubercle of the glenoid cavity. The long head of biceps went to the supraglenoid tubercle, while the long head of triceps is coming from the infraglenoid tubercle. It then unites to form this common tendon where the medial head and lateral head converge and all 3 attach onto the olecranon. We've also got a small muscle here which is known as anconeus, coming from the lateral epicondyle of the humerus towards the olecranon here, anconeus, but I won't really mention that. So if we look at the detail, we've got triceps brachii, we've got the long head coming from the infraglenoid tubercle, we've got the lateral head and medial head. The lateral head is coming from posterior, the humerus is coming from superior to the radial groove. So if we look here, the lateral head, this is the radial groove running down here. Superior to the radial groove, we have the lateral head. Inferior to the radial groove, we have the medial head. So here we can see superior to the radial groove, the lateral head, inferior to the radial groove, the medial head, separated by this radial groove here. We'll later on see an important blood vessel and nerve run along here. All of these 3 muscles converge onto the olecranon. They're supplied by the radial nerve, and they're important in extending the elbow joint. So they're the antagonist of brachialis and biceps. The long head, because it crosses the glenohumeral joint, also serves to extend the shoulder joint. I said I'd mention it just briefly, but we've got anconeus running from the lateral epicondyle of the humerus to the olecranon, also supplied by the radial nerve, and this really supports triceps in extending the elbow joint. So here we've got 2 dissections, 2 cartoons showing dissections of the posterior aspect. Here we've got a slightly more lateral view. We've got deltoid still intact, and we can see coming from this bottom inferior border of deltoid, we've got the various heads, long head, lateral head, and a medial head down here of triceps running towards the olecranon. And here, when deltoid has been exposed, when we've, removed deltoid, we can see that these muscles are running down towards the olecranon. We can see the olecranon here. We can see the radial groove here. We can see we've got the lateral head of triceps here and also here. What we've done is we've cut through the lateral head of triceps to expose this medial head coming from inferior to the radial groove. We've still got the long head up here. We can see it forming the quadrangular space here. We've got the long head, we've got the lateral head, which has been cut. Here's the other side of the lateral head, and we've got the medial head. These are all converging with anconeus onto the olecranon. So the proximal attachments of the triceps are shielded by deltoid. The proximal attachments are shielded by deltoid, but removal of deltoid can highlight their attachments, as we can see in this image down at the bottom. We can see the lateral intermuscular septum. the lateral intermuscular septum here, separating the anterior from the posterior compartments. And we can also, in this diagram here, remind ourselves of those three spaces on the posterior wall of the axilla. So the quadrangular space we can see here, the triangular space we can see here, and the triangular slit or the triangle interval we can see here. We can also, in relation to the radial groove, see the origin of the medial and lateral heads of triceps. Neurovascular relations are important on this posterior compartment. I'll talk about the ones that are passing up through the scapula in more detail when we look at the blood supply to the upper limb. But really, I just want to focus in on these muscles that are these blood vessels and nerves which are passing out of the triangular interval. We can see it here. Reminding ourselves that the triangular interval is formed medially by the long head of triceps, superiorly by the teres major muscle, and laterally by the humerus. We can see these nerves and these blood vessels are leaving the axilla and passing to the posterior compartment. We can see up here we have the axillary artery, and that is eventually becoming the brachial artery, and coming from the brachial artery we can see just here we have the profunda brachii artery. Here we can pick up the profunda brachii artery running in between the medial and lateral heads of triceps. It is accompanied by, if here remember the posterior cord, the radial nerve following the profunda brachii artery, and we can see the radial nerve now passing down to this posterior compartment. So remember the brachial artery as the axillary artery were in the axilla, and the posterior cord was in the axilla, and to pass out from the axilla to the posterior compartment, these structures had to pass through one of those spaces. Here they've passed through the triangular interval. So, separating the long and lateral heads of triceps, we've got the radial nerve and the profunda brachii artery. They pass to the posterior compartment via the triangular interval. The radial nerve from the posterior cord, the profunda brachii from the brachial artery. So in this lecture, we've looked at the brachial fascia and the intermuscular septa that separate the arm into compartments. We can visualize that with the arm in cross-section. We then looked at the anterior compartment of the arm, biceps brachii, brachialis, coracobrachialis. We looked at their function and their neurovascular relations. We looked at the cubital fossa, its boundaries and contents. And then we looked at the posterior compartment, specifically triceps brachii, its function, and the important neurovascular relations.